Geography and You presents
Hello and welcome to The Death by Fahrenheit, a new podcast series by GNY Live where we dive deep into the escalating threat of extreme heat. I am Hiteshika, your host. Heat waves are no longer seasonal spikes in temperature. They are deadly, intense, and widespread every passing year. In this series, we explore the science, the impact on biodiversity, and the urgent policy gaps surrounding this silent climate emergency. I'm joined by our discussant, Dr. Sulagna Chattopadhyay, Editor in Chief of Geography in You, who has been at the forefront of climate change publishing through GNY and has also authored numerous books on the subject. This episode features a leading voice in public health, Dr. Dileep Mavalankar, a medical doctor who is currently a senior professor at the Public Health Foundation of India and former director and the faculty of the Indian Institute of Public Health, Gandhinagar. Dr. Mavalankar has been instrumental in heat wave risk reduction strategies across India, notably contributing to the Ahmedabad Heat Action Plan, a pioneering model in climate resilient public health. I'm pleased to hand the conversation over to Dr. Chattopadhyay, who will lead us through this extreme event and a looming disaster for this summer and beyond. Over to you, Dr. Chattopadhyay.
Thank you, Hiteshika. Indeed, you have correctly pointed out it is a looming disaster indeed. A very warm welcome, Dr. Dilip.
Thank you. Thank you.
We are delighted you could make time for us because we are hoping that you'll help our listeners understand how cruel actually heat waves can be. And I'd like to begin by, I'd like to compliment the team because they came up with this very innovative title called Death by Fahrenheit, which kind of clearly brings to light the risk of heat waves. So, at the outset, Dr. Dilip, tell me, what is worse, heat waves or cold waves? What is it that human beings or the even biodiversity for that matter? What is it that we need to watch out for more?
Yeah. I think it's a good question. And as you may know, our Earth evolved over millions of years. And for last several thousand years, we have certain range of temperatures at different latitudes on the Earth. Like poles are always frozen, North and South Pole, whereas the equator is warm and humid. And in that kind of environment, all of us living at different places evolved. So, whenever the temperature changes in either direction, hot or cold, we feel uncomfortable to start with. And beyond certain degree of change, we may have physiological or bodily system stress. If it is cold, we have cold stress. If it is warmer temperature, we have heat stress. And given different countries evolved or different population evolved at different places, the stress, actually the number of Fahrenheit or centigrade at which different people feel stress may be very different. For example, if you or me go to England or Norway, we may freeze to death almost because it's quite cold, but the local population is very happy. And if they come here, they will sort of die because of heat. So that is the basic background. Now, your question was, should we be worried about cold waves or heat waves? What is more killing? So, as of now, the data across the world so far has shown that the cold temperatures have more mortality than the warm temperatures. But given the rapid change in global warming and climate change, the cold is reducing and heat is increasing. So in future, there will be probably more deaths because of heat wave than due to cold temperatures. So we are moving from a cold as a main public health threat to heat as a main public health threat. And it will vary depending upon where we are talking about. So the recent estimate from World Health Organization is that there are almost 5 lakh or 500,000 heat related deaths across the globe, and almost 40% of that happens in Asia.
Okay, so that could also be a function of population because we are more people in Asia. But
Yes.
having said that, the fact that you said climate change is bringing on, a public health crisis as such, as regards heat waves. Now, what is like to understand this crisis for humans, and even if you can touch on biodiversity maybe, so what is the health impact really? What happens to the human body in a heat wave that it can lead to death? What is it that changes?
Yeah, yeah, yeah. So, as you and your listeners may be aware, human body is made up largely of water, proteins, other minerals, constituting various body organs and body systems. And the whole body actually works on various very finely balanced chemical reactions. We eat food, we digest food, food produces energy that pumps the blood circulation, heart, brain, and every organ uses energy to do its functions. Now, most of these biological and even chemical reactions happen at certain optimal temperature. And for that, our temperature, uh, because of our evolution, is set at 37 degrees centigrade. Uh, so at that temperature of the body, most reactions of the body happen smoothly and most efficiently. As temperature goes up, the body tries to cool itself, because to survive, the body knows that if the temperature goes beyond certain limits, the chemical reactions may stop happening, get disturbed, etc., etc. So the body mechanisms are there to cool the body, and mainly the cooling mechanism is sweating. So body sweats, the sweats evaporate, and that evaporation cools the body. Plus, body also radiates heat like any other physical body. It also radiates and it touches the air or the ground, and some heat exchange happens from there. So there are three methods like any other physical body. Heat is getting dissipated, but in humans, sweating is the main special mechanism. Now, if the outside heat is much more than what the body can cope, then the internal body temperature starts going up, what we call as core body temperature,
Okay.
which is the temperature inside the body. And if it goes beyond 40 degrees centigrade, from 37 to 40, 44.5, then what happens is that many proteins and chemical reactions starts failing,
Oh.
because at that temperature it's almost like if you put an egg in boiling water, after some time the egg curdles, the proteins in the egg become denatured, or they curdle, and it permanently changes. So similarly, brain, kidney, liver, intestine, they are all made up of cells which have protein and other materials, and they start failing. Those reactions start failing, and that curdling of the proteins will start damaging the intestines, damaging the liver, damaging the kidney, damaging the heart, and damaging the brain.
Oh my.
And the most sensitive is the damage to the brain. And that is why, if you know, in heat stroke, the first symptom is a gradual loss of consciousness or becoming semi-conscious, and person becomes unconscious because some of the centers of brain which maintain the functions of the body and awareness, they start losing their effectiveness, and person falls down, becomes unconscious even though his heart, liver, everything is working.
Hmm.
Unless the person is immediately cooled, the further damage happens to the intestines. Intestines start leaking toxins in the body, the liver and the kidneys start failing, the heart and circulation may start failing. And that is how finally death happens because of overheating. So that is the physiology in a very simple way which kills. Now, if you cool the person very rapidly in short time, most of these processes reverse,
Okay.
and mostly without leaving any trace of permanent damage. But if certain brain centers are damaged or certain centers in the body are damaged, they may leave some permanent damage also.
So how long is a heat exposure really? I mean, does it vary from person to person, or can some people have more tolerance, or is it like, there is a threshold that these many
Yeah.
hours?
As I said, in body mechanisms, almost all parameters have tolerance. And the more you are acclimatized to heat, the more you can tolerate. I'll give you example of people in Northern Europe uh, in 2003 heat wave died at almost 30, 32 degree, 35-degree temperature in
Correct.
France and Spain and
Yes.
other places. In Chicago, similar temperature in 95 killed 800 people in 1 week. Whereas at that temperature, not many people die in India or in sub-Saharan Africa.
Yes.
Uh, so the more heat you are used to, the more resistant you are. But within that population, for example, in Ahmedabad population, when we had peak heat wave in 2010, when temperature reached 47 degrees, most people who died were older and also uh, comorbid because their tolerance level is much lower. That also happened in Europe. So young adults are more tolerant to excessive heat as
Okay.
compared to
Older
older
and
people, comorbid people, or
comorbidities.
newborns. Newborns also, like they are susceptible to cold temperatures and they may die. Similarly, they may also die because of hot temperatures.
Right, doctor.
Easy.
Yes. So now, taking it from there, do doctors really write that died or reason of death as heat? I mean, do you get a prescription or a death certificate which says that this is the cause of death? And
Yeah,
of course,
yeah,
NCRB data also, does it really take that and put it as heat
yeah.
related deaths?
There are two level answer. First level answer is in India. So far, we have never paid much attention to cause of death
Okay.
for any cause of death, not only heat. But if you look at malaria deaths certified, then there may be only 810, 1000 in the whole country.
Okay.
If you do any other cause of death, very few deaths. And most hospitals, doctors, uh, just certify as cardiorespiratory arrest or old age or some such causes which are not really. And neither the government has bothered nor the local governments so far. So most of our morbidity and mortality data are estimated. So that is the first problem. We haven't developed a system of properly recording cause of death in the country. Even recording many deaths may not be even recorded. But that apart, for heat, there is another problem that most of the heat related deaths happen in comorbid and old people. And heat exposure is like a final straw on camel's back.
Okay.
So they already have their heart, kidney, or other organs compromised, and heat proves to be
The
the
final,
last
the final nail.
final
Yeah.
insult or final injury, which triggers a chain of events which lead to cardiac arrest finally, or kidney failure, or dehydration and death, etc., etc. In that case, certifying death by heat becomes very difficult.
Hmm.
So in most times in Europe, in also in US,
Hmm.
scientists have used what is called as all cause mortality. That
Okay.
means total number of deaths in that population.
Hmm.
They don't look for only heat deaths, because even in the Western countries, heat deaths are underreported. Of course, there are certain places like Maricopa County in Arizona state, where Phoenix is, and is a very hot place in US.
Hmm.
Temperature goes above like 45, 48 degrees up to 50 degrees, which is like 120 Fahrenheit
Fahrenheit.
plus.
Hmm.
They have a good system of medical examiners for death. So each
Okay.
death which happens there, uh, which is not clear, is then submitted to the medical examination committee, and then decide whether it is by heat wave or heat excessive heat or not.
Yeah.
Second is the diagnosis of heat related death. Government of India has also recently put out a new guidelines of how to classify, how the
Hmm.
postmortem should be done, etc., etc. It is a cause labeled after excluding all other causes.
Hmm.
So it is not the first cause. Suppose first is temperature, whether it is measured or not, because sometimes in Europe and even in India, it may happen that patient may come dead in the hospital. Now, people may have cooled the patient thinking he has heat stroke.
Hmm.
When you measure the temperature of the patient or the dead body, it may not be hot.
Hmm.
So it is circumstantial evidence that, okay, he was working in heat, the temperature at that time was more than 40 degrees, etc., etc. And there is no other apparent cause.
Hmm.
He didn't had any other disease, malaria, or any other which will lead to high temperature. He didn't had any head injury or anything. So all that, removing all other causes, and if you have evidence of exposure to heat, then the doctors can certify uh, the cause of death as because of heat. So plus
So.
this training also hasn't happened yet.
Hmm.
So many doctors don't know, because these guidelines are very new. Government of India is now disseminating that and training
So
people
when
how
was
to.
this guidline? The
I think
year.
2024
Oh, that's
or
very, very
23.
recent.
Yeah, yeah, very recently it has come out. But see, what happened was that before we worked on Ahmedabad Heat Action Plan
Hmm.
2010
Hmm.
onwards, the only major heat wave event recorded was 1998 heat wave in Orissa, which
Okay.
claimed more than 2,000 deaths as per government records. And
Wow.
then Orissa state developed a heat action plan.
Hmm.
Even after that, nobody took heat as a serious event or threat, because under the National Act for Disasters,
Yeah, the
the
DM
disaster
2005.
has, yeah, has
2005
to,
DM Act. Yeah.
yeah,
Hmm.
they have to have human loss of life, animal loss of life, plus property damage. Because most of the other disasters, you take
Hmm.
earthquake,
Hmm.
cyclone,
Hmm.
flooding, has all of these. Whereas heat is a silent disaster.
Yeah. Yeah. Yeah.
It is,
But
there's no
it
property damage almost.
but it would impact livestock, wouldn't it? So
Yeah,
then
yeah, it does.
so
But
then that in
it
that
doesn't, that
context.
because there's no property damage, there is no visual evidence of it happening.
Hmm.
And that is why it is not included in the act. And
Yeah.
before that, no major disaster of that type had happened.
Right.
After we showed in Ahmedabad that heat caused 800 additional deaths in just 1 week,
Hmm.
it was then realized that even in a hot country like India,
Hmm.
heat wave can cause a lot of additional mortality.
Yeah. So
Otherwise, people thought that, oh, India, everybody is very acclimatized to heat.
right. So I will come to the Ahmedabad heat action plan that you have worked on, And from 2010 onwards, there has been some idea about what is really happening and some outcomes we would like to know. But before that, I'd like to just take this idea a little forward about older people, like the comorbidities being there and not being classified by the doctors as heat related deaths, really, and all the other complexities that you talked about. But I'd like to know about the labor force, really. If you have so if you have studied this younger people who come as labor, who work because of the construction industry, the construction industry, the construction that they do of infrastructure also, and they work through the day. And for example, there are instances in the UAE where people from Nepal have really gone worked through the day, and there's been really high temperatures, and they have suffered kidney failure, and they have suffered heart failure, stroke, and therefore lost their lives, which has impacted certain kind of policy changes as well of working hours, perhaps. So now I'd like to ask you from that perspective, that is there any ideation in our country about how to accommodate a heat wave and working hours in such a way that we are able to either take a break or complete or work before or after heat, the peak times
Yeah,
in a day? Is there anything that you can help
yeah, yeah.
on that?
Let me also a little bit give you background of what you are asking and then directly come to your question. Uh, the assessment and standards of work condition under which laborers or working population should work
Mm-hmm.
comes under a discipline called industrial hygiene.
Okay.
Unfortunately, that discipline is completely missing or very ill developed in India. It also falls under occupational health and occupational medicine. That itself is also very underdeveloped. So we don't have overall, besides heat, there are many other environmental, say noise, air pollution, dust pollution, cold, um, protection from falling from heights, workers' conditions in mines, etc. So all of that in developed countries are very fairly strictly controlled by this group of professionals called industrial hygienists.
Okay.
So they measure the environmental parameters under work can happen and how much work can happen before person becomes sick.
Okay.
And this is almost, I think, 100-year-old discipline. But somehow, neither the government, nor the university, nor the society has paid any attention. And that is why our labor regulations don't specify many of these things. We don't have professionals which measure all this. Now, with that background, I come to your question that what happens to workers in heat? So, as you know, construction sites, farm laborers, many other occupationally exposed, say a cook on a dhaba. Now, he is not only exposed to heat from outside, but he is next to the fire
Fire.
and he is
Absolutely.
exposed continuously. Similarly, furnaces or other industries where there is heat sources. So all of those workers are exposed and are likely to get heat related. Police people, say traffic police, working on the street vendors, all of them are exposed. And we need good measurements, regulation, and registration of their sicknesses and their deaths. Unfortunately, that is also missing. Uh, of course, we are a developing country, labor surplus country, so people don't bother. Why probably Western countries develop such regulation was that they are in a labor shortage type of economy.
Yeah.
They also value human beings much more than what we value. So all of that reasons, and also they are more science-based societies.
Science
We are
led,
not
we would
that
say.
much science-based society.
Yeah.
So, um, plus, many times they are powerful industrial interests which do
Hmm.
not allow such disciplines to um, develop, because then the it becomes more difficult to run the industries, because because for example, if heat goes beyond certain level, now regulations are coming that you must stop exposed work in heat from say 12 o'clock to 4 o'clock in the
Hmm.
evening, or
Hmm.
11 o'clock to 3 o'clock.
Yes. Yeah.
Now the
Huh.
question is, who will pay the workers for that lost time? That means worker, if he has to still do 8 hours work, has to do 8 plus 4 hours. So totally he will be at the workplace for 12 hours. So all those
Yeah.
kinds of things
Hmm.
start playing in.
Hmm.
I'm not saying that we cannot do it, we must do it. Once we start looking at the loss, we have done some studies with police force, traffic police, and almost 10% reported illness and hospitalization during the summer.
Hmm.
Even other exposed workers, very high rates of illness are reported. Unfortunately, we don't have
We
very good
don't have.
data
We
on
don't have
this.
data. You have been mentioning that. Now, just
The
to
other thing is, yeah, sorry. Other
no.
thing is also there is now measurement starting of loss of productivity.
Yeah.
See, if the temperature is 45 degrees,
Hmm.
you can't do as much work as you would be able to do at 38 degrees.
Hmm.
So same person may be present, but his work output may be like
Very
30,
poor. Yeah,
20%
it will be poor. Hmm.
less.
Hmm. Hmm. That I understand. Now, I just want to bring you here in on the Ahmedabad Heat Action Plan. And if you can just tell us a little bit about the outcomes of what happened there, and, what were your experiences as far as
Yeah.
building it were.
So the plan started because of the heat wave of 2010. And as I said, within 1 week, the data from the Registrar of Birth and Death,
Hmm.
which we analyzed at IIPH, showed that 800 additional deaths had happened just during the heat wave period. And there was no other epidemic or no other cause to account for these deaths. So these are all heat associated or heat related deaths.
Okay.
Now that opened the eyes of the city as well as us as a public health institute and our partners NRDC
Hmm.
uh, to develop the heat action plan. And we developed it looking at the heat action plans of other countries
Hmm.
in the West and adapting it to Ahmedabad. And the plan got implemented in 2013 as a pilot plan.
Hmm.
And from 14 onwards, it was improved, and each year it is now implemented. We earlier used to start from 1st of April, but within 10 years, the heat season has almost shifted 1 month. So now the plan starts from 1st of March to end of June.
Okay.
The plan has four main pillars.
Hmm.
The early warning system, which is based on the analysis of mortality. We have yellow alert at 41 degrees, orange alert at 43 degrees, and red alert at 45 degrees.
Hmm.
Um, so through media, people are alerted. We have 5-day advance alerts of what the temperature is going to be. Then awareness of the people, because half of the actions people can take themselves, like don't go out if there is a red alert, unless if you have to go out, you can't avoid it. Then take water with you or drink a lot of water and go walk in the shade, take an umbrella. After reaching wherever you want to reach, cool down or take another glass of water. So preventing development of heat stroke. Second is, if heat stroke like symptoms appear, you feel giddy, you feel very hot,
Hmm.
lot of sweat or cramps in the legs, you immediately go to a health center or a doctor and get yourself treated. Because
Okay.
the first thing, like golden hour in many emergencies, this also has the same concept. Earlier you get. So that is what people. Third pillar is uh, preparation of the medical and paramedical
Hmm.
system
Hmm.
to treat heat emergencies in a rapid and proper way.
Okay.
And fourth is long-term and short-term measures like making water available everywhere in the street free of cost. then having greenery planted,
Hmm.
having shade developed, changing working times of the people, alerting, uh, taking care of older and young people who are more vulnerable, pregnant women, etc. So there's, and last few years we have added cool roofs, which is white paint on the roof so that heat ingress becomes less and
Less. Yeah,
less.
they say 5 degrees
So
it can
yeah,
reduce. Yeah.
these are the kinds of actions
Yeah,
which
but
were done.
you did mention office in one of them. So, does Ahmedabad have different office timings, for example, during a heat wave or a red
As
alert point in time?
as of now, we don't have, but last 2 3 years there have been labor regulations put in place at time of red alert. So
Okay.
when there is red alert, the construction sites, road activities, etc.,
Hmm.
are ordered to be stopped from 12 to 3 or 4 p.m. So that has started. Of
Yeah.
course, schools are off.
Yeah,
Some
schools shut
other
down. Hmm.
organizations have uh, holidays or vacation, so they are not there. The other thing people also know, so if red alert is there, you go on the road, you will see as if there is a curfew. Not many people will be seen on the road unless they
Hmm.
have to go. So people also follow the newspapers, alert people, etc. So,
Yes, of course.
but
The
of
media,
course, many
role of
people
media. Hmm.
whose livelihood depends on work day to
Yeah.
day, they have to
Hmm.
go out and work. What was the impact of this heat wave in Ahmedabad?
Ahmedabad, yes.
I mean, heat action
Yeah,
plan.
yeah, yeah.
So what we observed after 3 years of implementation of heat action plan, which is 13, 14, 15,
Hmm.
we did a study to measure what is the impact on mortality. And what we saw using the same data as we had seen earlier from Registrar of Birth and Death,
Hmm.
that peak heat wave mortality had declined by about 47%.
Oh,
Yeah, yeah. And that is also published as a scientific paper in 2017 or 18, I think. And we are
okay.
now redoing the analysis because in between 2 years of COVID went, so all the data was not really usable. We are redoing the analysis. And because of that proof that the heat action plan seems to be reducing uh, heat wave related mortality, the National Disaster Management Authority took this as a model plan and encouraged many states, cities, and local governments to develop similar heat action plans.
And where
Uh,
where have they come up after Ahmedabad?
Very systematically, they do organize workshops, etc., before the summer in February, January, March.
Hmm.
And now, at least on paper, there are 250 heat action plans
Okay.
in India in various cities. For example, Nagpur, after our work, the Maharashtra Health Secretary invited us to Nagpur because it's a very hot area.
Hmm.
We conducted workshops. So they were the first to develop heat action plans in 7 cities around Nagpur because that's a very hot area. Then Orissa already had, so they also developed in Bhubaneswar city.
Hmm.
Delhi uses a different type of heat action plan during that graded heat action activities. Jodhpur has recently developed 2 years ago. Thane is developing,
Hmm.
and now some NGOs are helping. Almost next 3 years, another 350 heat action plans. Now, the only thing is that developing a plan itself is not enough unless it is backed by budget
Hmm.
and political and administrative uh, mandate or follow up. So
Um,
that is the
that is the
status of the
key.
heat
Yeah.
action plan.
So I just want to revisit now.
Yeah,
47% decline, you said.
yeah,
And I want to juxtapose this against temperature anomalies. So, how many extremes have you seen in the time period that you are finding a 47% decline? So, can we
yeah,
just juxtapose it against? So, basically, are
yeah,
we seeing worsening heat waves and bettering outcomes? So, that is
yeah,
my
yeah.
question.
Sure, 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 sure. We have worsening of temperatures and mortality still increases. For example, I didn't give you this number, but normally all-cause mortality in Ahmedabad at that time, 2010, was about 100 deaths every day with normal temperatures, with all causes in May.
Okay.
Now, in the peak heat wave day, 21st of May 2010, there were 310 deaths. So 210 deaths additional. And the week which followed had 800 additional deaths. Now we still see mortality does go up to 200, 250 instead of 300, but it is about 40-50% less than before, even though temperatures have going up much more. Second, which people don't realize because everybody is focused on maximum temperature. But it is not only maximum temperature, but it is the minimum temperature also going up is more dangerous. Because if maximum, you might have heard in many parts of deserts, the maximum temperature goes to 50 degrees, Churu and other places. But the minimum is quite cold, even in summer. And that is where the body gets time to cool off and recuperate. So if maximum temperature in Ahmedabad, if we saw that more than 45, but minimum remains less than 28, then mortality doesn't increase so much. But if it goes above 45 and minimum crosses 30 degrees, just 2 degrees higher, then the mortality almost is 2.5 times. And in climate change, along with maximum temperature, the minimum temperatures are also going up. And that is why mortality will increase. And especially in urban areas, we didn't get time, but there's something called urban heat island effect. So that also maybe in future you can ask other experts to talk about it, because that also makes the nights much warmer than what the climate change will do.
Thank you, Dr. Dileep. We had a very interesting conversation, and we will definitely work upon the urban heat island problem that you have highlighted and present it in a podcast later on. And it was truly enjoyable, Professor. Thank you once again. Hitishika, I would request you to kindly conclude our podcast for today.
That was a powerful and insightful conversation. Thank you, Dr. Chattopadhyay, and our deepest gratitude to Dr. Dileep Mavalankar for sharing his decades of experience in public health and climate adaptation. Dr. Dileep is currently an advisor to the World Bank's Global Facility for Disaster Reduction and Recovery and has been providing inputs for heatwave action plans for South Africa, extending his impact beyond India to the global stage. From real-time heat alerts to the public health innovations like the Ahmedabad Heat Action Plan, today's discussion showed us that while the threat is real, solutions can help minimize. The rising temperatures are daunting, but with science, strategy, and community resilience, we need to find impactful ways to reduce human imprint on the global scape. To stay informed on what's happening around you, follow us on Spotify, Instagram, and YouTube. Subscribe us so that you never miss an episode. A detailed blog of this podcast will be soon uploaded on www.geographynU.com with all the additional links and references. Join us in the next episode of Death by Fahrenheit as we uncover more layers of this unfolding crisis. Until then, stay informed, stay cool, and don't let the heat catch you off guard.